Let's stay with you, Leah. I wanted to go back to an EPA report that I just spoke with Administrator Regan about from September. That found people of color are exposed to higher levels of pollution regardless of where they live or their income level. These exposures can have very serious public health implications. And I wanted to ask you, what does findings like that, and of course similar findings have come from other studies, what does that tell us about systemic racism and in particular its effect on public health?
It's really scary when you look at the data because these studies have been around since the 80s, and the Environmental Protection Agency has been well aware of these connections when it comes to race and income and communities experiencing a pollution burden. However, there is a lack of communication between the communities that are facing this pollution burden because the more and more I talk to people, even in my hometown of St. Louis, and say, did you know that African American communities regardless of their income level, are exposed to over 70, they're exposed to pollution that's in violation of federal air quality standards. And there are so many Black and Brown communities that are just living in increased air pollution. And they might just think, okay, a lot of people in our neighborhood happen to have asthma or have these respiratory illnesses, but it's actually linked to that increase in particulate matter. So I think something that's really important, because the studies have been there for a really long time, is educating people in these communities that this is happening, because oftentimes people will say that asthma and these respiratory illnesses are genetic or it's hereditary, but they're kind of ignoring the systemic racism that's at play that's allowing this environmental racism to happen. So there needs to be bold action at the federal level, because again, these studies have been there for so long, and there also needs to be increased communication to let people know in these neighborhoods that this is happening, and this is something that can change with proper policy protocols.